Hello everyone. Today we are going to talk about the postnatal or the postpartum period. This is the time following the delivery of the birth of the baby, and it usually includes the first 6 weeks after the delivery of the baby. This is a time which is also marked by a lot of physical, mental and emotional changes, and actually can be quite a roller coaster period, and it can be a very turbulent phase in your life unless you manage it properly. So here are some tips, some information to guide you through this period. Let's talk about the physical changes. The first important change is the bleeding. Bleeding following delivery is absolutely perfectly normal. In fact, we have a medical terminology for this, and this is called Lochia. So the first 4 days, the bleeding can be heavy. It can be a little painful, accompanied by mild cramping. There can be a little clots. This is called Lochia Rubra. It is red in color. Then for the next 4 to 12 days, we have what we call the Lochia Serosa, where the bleeding is actually light pinkish in color and you experience a moderate flow. And finally, we have the Lochia Alba, which is more like a vaginal discharge, which is almost white to yellowish in color. Lochia is actually a way for the body to clean itself. That means the excess fluid or the blood which has been left in the uterus tends to drain out. Remember, there should not be much pain or fever or offensive odor in the lochia. The other physical change is the afterpains. A lot of patients expect that once they have delivered, they will not experience pain, which is not correct. So you may have mild menstrual-like cramping, and this is actually because your uterus is shrinking. And we have seen that during breastfeeding, that is the time patients experience the maximum and the most intense cramping. This is also absolutely normal. The third change is breastfeeding. And believe me, this is a very big change in your life. So breastfeeding is very important for your baby. While it is a convenient, safe, sterile way of providing milk to your baby, it is also something which is full of antibodies and will help develop the immunity of the baby on a long-term basis. We have also seen that infants who are breastfed have a higher IQ. They also have a lower tendency for diabetes and obesity. And in fact, mothers also really benefit from breastfeeding. Women who have breastfed their infants have lower chances of breast cancer and ovarian cancer. Not only that, breast milk is uniquely made for your baby. Did you know that a term baby and a preterm baby, the mothers will produce a different kind of milk? In fact, there have also been differences between milk for a male baby and female baby. So you must try to breastfeed your baby. Breastfeeding can be done in different positions, and try and get in touch with your doctor to understand which is most comfortable for you. Finally, not something that you can really ignore are the mental and the emotional changes. So while you may be absolutely joyous, you may be excited to have your little one in your hand, it may also be accompanied by depression, anxiety, irritability, and mood disorders, which sometimes become difficult to comprehend for the family. But you must understand that this is a period of change. Like I said, lots of physical changes, but also mental and emotional changes. Sleep is disturbed, there is hardly any me time, personal care becomes lacking. Your relationships may undergo a change since you may be forbidden to have sex. Attention of the family actually shifts from the mother to the baby. One may feel really overwhelmed to take care of the baby. In fact, the whole prospect of the life getting changed can really overwhelm you. So don't worry, most of these changes are temporary, and one should prioritize self-care during this period. So to help you sail through this difficult period, my advice would be that you sleep when the baby sleeps, right? You have a very good diet. A balanced diet is very important during this period. Light stretching exercises really help you, because sometimes in the postpartum period, women also feel lack of confidence due to urinary or stool incontinence. So doing your Kegels will really benefit you not only in the short term but in the long term as well. try to make a bond with your baby, try to breastfeed your baby. So all of these things will really help you, and if you need, then you should take help. That is very, very important. Support from family or having a good help at hand really helps you through this period. Also, be regular with your visits. Often we have seen that by the time the delivery has taken place, patients start lagging behind in their visits, and one should go to their doctors just to make out if you have any complications or whatever supplements you need. So follow these things and you should sail through this turbulent period of your life.